Hello, and thank you for joining this OncLive peer exchange titled Optimizing Treatment Selection in Liver Cancer. Surgery, resection, liver transplantation, and radiofrequency ablation remain the only curative options for patients with hepatocellular carcinoma. However, important advances in systemic therapy as well as local regional therapy are improving management of this disease. This OncLive peer exchange panel of experts will focus on the evolving treatment landscape, including how the latest evidence interplays with the complexities of the disease to impact clinical decision-making. I'm Ghassan Abou-Alfa, and I'm a medical oncologist at the Memorial Sloan Kettering Cancer Center in New York. Participating today on our distinguished panel are Dr. Richard Finn, Associate Professor of Medicine at the Geffen School of Medicine at UCLA and the Division of Hematology Oncology at the University of California, Los Angeles Medical Center. Dr. Kelley, Associate Professor of Clinical Medicine in the Department of Hematology Oncology at the University of California, San Francisco. Dr. Kulik, Professor of Medicine, Radiology, and Surgery in the Department of Medicine and the Division of Gastroenterology, Hepatology at Northwestern University Feinberg School of Medicine, Chicago, Illinois. And Dr. Riyad Salim, Vice Chair for Image-Guided Therapy and Chief of Interventional Radiology in the Department of Radiology at Northwestern University Feinberg School of Medicine, Chicago, Illinois. Thank you so much for joining us. Let's begin. Well, good evening, everybody. And I would like to start with a thought on multidisciplinary approach to therapy. And Richard, so how does multidisciplinary work at UCLA?
Well, multidisciplinary approaches are important in many of the cancers we treat. I think especially in liver cancer, this approach is critical to providing patients with the optimal management. And that really is because it's two diseases. It's not only the malignancy, but also the underlying liver disease. And because of the critical role of surgery, especially liver transplant and liver resection, as well as interventional radiology in managing the disease, a multidisciplinary tumor board is, I think, the ideal way to approach patients. So at our center, for example, we meet every other week, and the tumor board consists of hepatologists, liver surgery, medical oncology, both diagnostic and interventional radiology, and even radiation oncology. And we approach patients where typically there's not a clear-cut one right answer, and we have an open discussion about what is evidence-based and then individualizing that for each individual patient.
Great. So Laura, I have a thought here. So obviously I can understand if there's a transplant center, a hepatologist will be a very critical part of a team of that nature. But Richard just referred to the two diseases in one. How do you see the role of hepatology, not necessarily only in the early stage disease, but rather in the advanced stage as well?
So as patients' liver cancer is advancing, they're often having complications of portal hypertension. They're more likely to have variceal bleeding, for example, and also more likely to die as a result of that. So also ascites, so trying to manage not only from a mortality standpoint, but also from a comfort standpoint is very important. So a hepatologist will try to treat the underlying disease as well. There are very potent hepatitis C medications that are now available, and it's become a little bit controversial as to when to treat patients with hepatitis C with HCC, but that's another role for the hepatologist.
Great. And if I come to you, Katie, it's interesting, kind of, in some interactions here and there, I always hear medical oncologists say, we're busy in clinic, we really don't have time to go to the multidisciplinary. And kind of, inferring that their role is so well defined because of systemic therapy is for metastatic disease. What can we tell our friends there?
I think especially for liver cancer, more so than many other cancers, we really rely on our colleagues across disciplines in hepatology, IR, surgery, across stages of disease, and particularly in advanced disease. Even if a patient's receiving systemic therapy or chemotherapy, I'm often consulting my hepatology colleagues to help with encephalopathy or the complications of end-stage liver disease that can evolve as a cancer progresses, or with treatment toxicity. Also with some of the more esoteric issues that can occur with reactivation hepatitis that can happen on systemic therapy. So we often are employing antiviral treatments. And so it's a multidisciplinary disease from start to finish, from early stage to advanced.
I totally agree. And if anything, if I add over here that obviously for the patients, as we evolve in the therapy, always we understood it kind of like categorized as being resectable, curative, intent, locally advanced, and metastatic disease. But obviously, there's a lot of kind of, discussion back and forth as we see those kind of, different categories kind of coalescing together in many aspects.